This podcast is a Christian view of the controversial subject of gender identity.
Welcome to the latest episode of Star Cells and God. My name is Rana. I am a biochemist and a Christian apologist. And today I'm joined in studio by Dr. Christina Cirucci, who is a board-certified OB-GYN. And today we're going to be talking about the question, if you've undergone gender transitioning procedures, can they be reversed? Well, Chris, welcome to Star Cells and God.
Thank you so much for having me. It's great to be back, and it's great to be here in person once again.
Yeah. You've been on the show a number of times now, most of the time through Zoom.
Yes.
But there's been one episode where you've been here in studio, so I'm glad to have you here in studio with us. And just for people that are watching and may find some of the topics that you discuss interesting, we've done a couple of programs with you on the dangers of chemical abortions and abortion pill reversals. We've also done a number of shows with you about gender identity questions. I think the dangers of puberty blockers and cross-sex hormones. We've done a show with you on gender reassignment surgeries.
Yes.
And it seems like there's something else that I'm missing. But
yes, we've done quite a few.
Yeah. So anyway, but I would encourage people to go through the archives and take a look at some of those past programs because they're very, very good in my opinion. Well, today we're going to be talking about a really important question, which is about detransitioning,
Yes.
right? Where people have undergone gender reassignment procedures and they change their mind,
Right.
and they want to revert back to their original gender.
Mm-hmm.
But before we do that, we should maybe take a minute or two and just set the context that this whole question that we're engaging is part of a larger project that we've been undertaking here at Reasons to Believe on the whole question of gender identity. And so we've been able to form a team that you headed up. Thank you so much, from our scholar community of primarily medical doctors, but also a philosopher and a biblical theologian, to really wrestle with a number of questions centering around the whole issue of gender identity, primarily looking at it from a medical perspective. Mm-hmm. And this is part of a larger project where we are looking at how does the medical science intersect with the biblical perspective on gender. And we're going to be talking about medical issues, so I just want to make sure people understand that we're not giving medical advice, that if people, have questions, they really should be consulting their own personal physicians. So, Chris, maybe tell us a little bit before we get into this question today. What was the motivation behind the whole gender identity project, and what was the approach that you and your team took?
Right. Thank you, Fuzz. Well, we all have seen the increase in gender dysphoria and transgenderism, and what we need to realize is these are real people who are struggling, and we want to help them. And of course, as physicians and scientists, we also want to know what is the truth. So as a physician, I don't want to offer my patient a treatment that doesn't help. If I offer treatment, I want to know that there's benefit to it and that not harm. And so at the gender identity team, we did a deep dive into the research in all areas because we wanted to know, what does the data show? And the reason behind that is because we want to help people. We're not here to attack or anything like that, but really we believe that truth is important and that truth is what's going to help people.
Yeah, Chris, I really appreciate that because, our objective here at Reasons to Believe is not to engage in the culture wars on these particular issues, but it's really to help people that are real people that are hurting, or people that are parents, grandparents, pastors, church leaders who know somebody who's struggling with issues of gender dysphoria.
Yeah.
Where can they go to get good, reliable, trustworthy information that's free of agenda? And that was really the objective of the team. And I thought the team did a marvelous job in fulfilling that objective.
Yes, that's well said. Thank you.
Okay, so today we're talking about this whole idea of detransitioning. And people may or may not have heard that term, but this is in the larger context of what's known as gender-affirming care.
Right.
So maybe just give us a quick overview of what is meant by gender-affirming care.
Right. Well, gender affirming care, of course, that's a type of care in which a person who wants to be a different gender than they were born as, say a girl who wants to be a boy, goes through a process of transition. But in what's called gender affirming care, the provider actually just affirms and agrees with what the patient wants. There is often, with gender affirming care, little evaluation into the underlying problems. Many of these people suffer from mental health and autism and history of trauma or abuse. So in gender affirming care, which is what we see in most gender clinics, the provider is quickly affirming that gender and then giving them, providing that treatment. And we often think of it as four kind of steps or four categories. And the first is social transition, in which the person will take on the name of the opposite gender, the pronouns, the clothing, the hairstyles, and often also doing some kind of, a girl may do tight binding of the breasts and things like that. So that's social transition. And then the next step is, if a person hasn't gone through puberty, is puberty blockers. And that's an injection, typically an injection of medicine that stops the normal physiologic process of puberty. And then the next step is what we call cross-sex hormones. So taking the hormones of the opposite sex. So a girl who desires to be a boy will take testosterone, and a boy who desires to be a girl will take estrogen. And then the final step that some people do is surgery to appear more like the opposite sex. Now, we'll say we kind of outline these as steps, but everybody's different. So not everyone goes through these four steps. Some go through part of it, not all. But that's kind of an overview of what we're looking at.
Yeah. Yeah, and so someone can, as you're mentioning, stop with just social transitioning. Others can maybe social transition and do cross-sex hormones, and then some will go to the extreme, which is to actually do gender reassignment surgery.
Right.
So then what we're talking about today is, well, what happens if you've done, one or all of those steps and change your mind, right?
Right.
And so we hear terms like detransitioning. I also hear terms like desisting and regret. So what is meant by those terms in the context of gender-affirming care?
Sure. Then that's important to understand the terminology. So detransition, it refers to stopping or reversing a transition.
Right.
Now, that we want to talk about regret because it's important to distinguish. Not all people who detransition do so because of regret, and not all who regret their transition will detransition. So a detransition would be, we talked about those four steps, would be either stopping, so stopping the hormones, or stopping, the social transitioning, starting to wear your hair and your clothing and your name and whatever as your birth sex, and stopping some of those processes would be the detransition. Stopping the hormones, sometimes maybe even having surgical changes. Desist, you brought up desist, that's something completely different. So desisting is when someone has gender dysphoria and they don't transition. And then with time, they become comfortable in their birth sex, desisting. And so we see this often in the early onset gender dysphoria, which is usually young boys at the age of 3 to 4, very rare historically. But most of these boys who may have felt they wanted to be a girl and suffered from gender dysphoria, if given time and not pushed to transition, they will desist. So they will become more comfortable in their birth sex.
Yeah. Okay, so important to clarify those terms. Now, what about desisting with, teenage girls who experience what is known as rapid onset gender dysphoria? This is a relatively new phenomena, right, where, teenage girls predominantly
Right.
decide that they are of a different gender. Do we see desisting happening with a high frequency in that particular category? Because my understanding is that this is driven largely by social influences, not exclusively, but largely by social influences.
Yes, and I don't know the percent who desist. I would encourage that. Girls who suffer from gender dysphoria or who want to be the opposite sex, because there are a lot of often underlying issues. And of course, as you see with the transition process, I mean, there are permanent results. So you really don't want to go through a permanent process like that very quickly, or you need. Of course, this is part of the issue with gender-affirming care is the minimal evaluation. But I think we need to, when we look at detransition, and that there are people that detransition, it has to give us pause.
Right.
So a young girl who's had a double mastectomy and taken testosterone and now has a deep voice and now regrets it. Well, what does that say about what she was, the path she went down?
Yeah. And I would intuitively think that desisting would be pretty common in people with rapid onset gender dysphoria, just because it does seem like a significant part of the etiology is, again, social influences.
Well, I think desisting, if they resist the transition, would be common. I think, unfortunately, what is happening is they're being maybe encouraged to transition. A girl who struggles, maybe she's been sexually abused, and we hear of girls who have been abused by a boy, so they want to become a boy so they don't get abused, or they've been bullied, or, I mean, these are terrible situations, or they're depressed, or they have, underlying issues, and they may be under the impression that if they transition, that's going to solve their problems.
Right.
And then they find out, many of them, that it doesn't.
Yeah. Okay, so then when it comes to detransitioning, scholars that work in this area have identified two different types of detransitioning.
Right.
So, and you've already made some allusion to the differences.
Right.
So maybe
Sure.
give some more clarity to this.
So there was an article by a scholar, Esposito Campos, where he identified two types of detransition. One would be primary, one would be secondary. So primary are people who will re-identify with their birth sex. So say a girl makes a transition to male and then detransition and then once again identifies as a girl. The second type, or secondary, is when the person still identifies as transgender. And again, this depends on your definition of detransition, but there are people that may stop their transition or reverse it due to other reasons. Maybe they have trouble getting a job, or they feel pressure from family, or they've had some health adverse effects, and yet they still would identify as transgender even though they've stopped that process.
Okay.
So as we've said, everybody's different. It's not a homogeneous group.
Right.
Everybody has their own story.
Right. Now, what is the percentage of people who detransition?
Well, that is a $64 million question. So the claim out there is that it's very low. So if we look at a couple studies, one that's often quoted was the one by, I don't know how to say the name, Weeps, out of Europe, which showed a detransition rate of 0.5%. So that's only 1 in 200. But the problem, the issue with that number is, as with a lot of these studies, is that when they follow people, there's a large percentage of people that they don't know what happened to. And that's the case in that study. There was a 36% of the people didn't follow up with the clinic. So in that sense, then your detransition rate could be as high as 36.5%. You have a 0.5% that detransitioned, but you have 36% that you don't know what happened to them.
Yeah.
And we do know that those who detransition do not typically go back to the same provider. So another study showed 1%. It was a systematic review. So that's where they pool a lot of studies together. And again, these studies had a very high percent, around that same range where they don't know what happened to those people. And so we can't say it's 0.5% or 1%. No, I don't think we know what that number is, but I think it is much higher. There's other studies that show higher percentage, but people have certainly challenged those low numbers.
Yeah. Yeah. Well, and a point that you made earlier that I think bears repeating is that even if you're dealing with 1% or 5% of people, it's just to throw a number out there, that decide to detransition, and whether it's because they've changed their mind about really what gender they identify with, or if it's because they're uncomfortable with the medical procedure, that in and of itself is not inconsequential, right? It's suggesting that maybe there isn't all that we think there is, right, with gender-affirming care.
Right. I would agree with you. 1%, this is 1 in 100 people. That's not insignificant. It's certainly not significant for that person. But we have reason to believe the number. People have said there was a recent article by Substack or GenSpec that estimated it could be as high as 33%. And remember, not everybody who regrets detransitions. So it's a complicated thing. We don't have the number, but I suspect it's quite a bit higher than 1%.
Yeah. Well, if you go all the way through the 4 steps of gender-affirming care, right, and you've undergone reassignment surgery, you can regret it, but there's not a lot you can really do to undo that, right?
Right. Well, and there may be some of those people may have some surgical intervention to appear more like their birth sex. But these are permanent surgeries that people are having. And so that brings into what do people do? And it varies, because for some people it might be maybe having some surgical intervention to appear more like their birth sex. For some it might be stopping the hormones, and then stopping the social transition.
Yeah. All right. So why is it significant that we don't know the percentage of people who have detransitioned?
Yes, that's a great question, because that is exactly what the gender clinic should be asking. How are these people doing? And this was brought up in that GenSpec article. This is what we should be asking. How are they doing? If I, as a surgeon, did a surgery and didn't know what happened to 35% of my patients or something, I would be worried. If I didn't know, if I even had 1% that regretted their surgery, I would be very upset. And so we want the best for these people. And so a gender clinic really should be wanting to have good data. They should want to know. These are people.
Yeah.
And the fact that they don't know is concerning.
Yeah. And they do have the obligation then to track that down that data, to produce that data, right?
I would say yes, but again, remember, patients who detransition tend to not follow up with the person that provided their transition.
Yeah.
And so, but yes.
Yeah. Okay, so when does the detransitioning take place, and how long after the transition?
Yeah, and that's an important question because some of these studies that look at detransition rates may only look out, say, a year or a certain amount of time. And what we found is that probably the regret and the detransition happens farther out. The average is probably about 10 years. And, you know, people may have these interventions, these surgeries, and may feel a bit of relief initially, or they may feel it helps them. Everybody's different. The data does not bear out that it's beneficial, but that doesn't mean that people don't feel some sense of relief. And it's a long process, so they may feel relief in getting through it. But yeah, detransition usually happens farther out, like I said, about 10 years. So unless you're looking that far out, we don't really know.
Yeah. And I mean, have there been studies that even have gone that long, right? Given really the relatively recent attention that's being paid to gender-affirming care.
Yeah, that's a great question. And unfortunately, we don't have a lot of the data, the long-term data that we'd like to have.
Yeah. Okay. What are some of the difficulties with detransitioning?
Right. Well, one of the difficulties is it's actually harder to detransition than to transition. So in gender-affirming care, if the person goes in and says, a girl says, I want to be a boy, she's affirmed on that path and sent on that path pretty quickly. But to detransition, if she would to go back to that same place, it would be harder to get the medical support. In fact, WPATH, the World Professional Association for Transgender Health, has more requirements to detransition than to transition. To transition, you need one provider. To detransition, you need a team of many, multidisciplinary team. The other barrier that people face is people have reported that they're encouraged to transition. The LGBTQ community supports them, and they have the social support that then when they go to detransition, they lack that support. And I think as Christians, that's something we need to be very sensitive to and aware of, that, to be supportive of obviously of people wherever they're at, but particularly these people who are detransitioning because they've just lost their support group, many of them.
Yeah. So there's a stigma then placed on people who want to detransition.
That is what some people will describe. I don't know if they use that term, but they speak of not having the support, of losing their support group in that community. The other thing that's difficult, I want you to picture this. So you have someone, say a young girl who has transitioned to look like a boy, be a boy, whatever. Maybe she's taking testosterone, her voice has deepened, she has facial hair, everybody knows her as a boy. Maybe she's had surgery, maybe not. She goes to school for years and years as a boy. That's how people see her. And then she decides to change. Like, that's not going to be an easy path, just socially, if you think about it.
Yeah.
So these are people that, everyone, they need our support. Obviously, we want to be there for anyone suffering from these kind of things, but I think there's a particular place we need to step in with the people who feel they need to detransition.
Yeah. So what is the process that people go through then when they detransition?
Well, again, everybody's going to be different in how much they did, but again, they usually don't return to the same provider. They usually have a harder time. But so to reverse the hormones, you're just going to stop taking the cross-sex hormones. The person, depending on whether they did the puberty blockers or whether they went through their normal puberty, and there are, long-term effects to all of these. And then obviously changing the social transition. So starting to, some of these people have legally changed their name, but there's some things that can't be changed. A woman who's had a double mastectomy to appear more male, well, she could have breast implants, but she can't get her breasts back. She can't ever breastfeed.
Yeah.
And so it's going to be a different path for everyone, but certainly not an easy one.
So let's say if you stopped taking cross-sex hormones, can you reverse some of those changes by taking a higher dose of the appropriate hormone now that would correspond to your birth sex?
You can't reverse it all. Deep voice from taking testosterone, stopping the testosterone, and whether she takes estrogen or maybe if she's had her ovaries out, or if she won't even produce the right amount of estrogen, or if she takes estrogen, or if she has ovaries and they start producing estrogen, that may help some, but that's not going to bring back the female voice. So there's some changes certainly, but a lot of this is you can't undo all of what's been done.
So this is actually a significant point, in my opinion. It's not just simply if you've had the gender reassignment surgery that it's very difficult to go back, that you can't go back in many cases, depending on what the procedure is. But it's even true then in terms of even if you stop the cross-sex hormones, or if you block puberty, obviously you can't redo puberty. So this is pretty significant. In other words, what we're really saying is that if there's regret and you want to go back, you really can't.
You can't completely go back. I would encourage people to do what they can, obviously, and there can be changes that can be made. But there's a detransitioner who's on social media and really promoting better research. Her name's Michelle Oliva. And I was really taken by her videos because she has this video that she does like in stages, like I'm a week into testosterone, I'm 2 weeks into testosterone, I'm 3 weeks into testosterone. And so she does these, you hear her voice getting deeper and deeper. And then years later, she detransitions and she still has a deep voice. And of course, she looks like a woman now, and but there's some of that she's lost, unfortunately.
Yeah. Okay, so what have we learned from people that detransition, in terms of maybe a qualitative assessment of their stories? What have we learned?
Yeah, and there's some really touching stories out there, if I could maybe tell a few. And again, this is their story, so I encourage people to read their books and look them up. But Laura Perry Smaltz is a woman who was born a woman, and she was molested, and she felt that her mother had a couple miscarriages of boys, and so she felt that if she couldn't be loved as a girl, she would become a boy. And I think she had a period where she's had some promiscuous period of time and just felt not treated well, and so that she decided to become a man. And she took the hormones. She had a mastectomy, and I believe she had a hysterectomy, and she went by Jake. And her parents are believers. They never used her name Jake. They always called her Laura. But they continued to love her. They continued to invest in the relationship. They continued to pray for her. And I think this points to just how, for many, this is a long haul. Mm-hmm. This is just the long game. And I love Laura's story because she told God she rejected him or was not going to serve him ever again. And her parents just kept loving her. I think her story is that they would just on a regular basis go out to eat with her and, again, invest in the relationship. And then one time, Laura's mother was doing a Bible study at church and asked Laura to put this stuff, the Bible study, on the website. That was a skill that Laura had, or her name, she went by Jake at that time. Sure, I'll put this on the website. And of course, during that process, God spoke to her, and in time, she realized that, God's love, and she realized she was embraced by the church and the women in this Bible study, and just got this pile of cards from people praying for her, and she came to Christ and detransitioned, and then actually got married to a man. And a lot of that was, her, obviously the power of Christ and God's work in her life, but the love and prayer of her parents, and just being there with her in the long haul.
Yeah. That's a powerful story, yeah. And it speaks about the redemptive power of the gospel, right?
Yes, yes.
That the gospel has real power to
Yes.
redeem people. And that in and of itself is a testament to Christianity and to
Yes.
the truthfulness of the gospel. So, what would you say to someone now, first as a physician, and then secondly as a Christian, who is coming to you and says, look, I think that I'm, I was born a female, but I really think I'm a male, or I was born a male, but I really think I'm a female. Or maybe, what would you say to parents who might have a child who identifies as transgender? What would be your counsel, first as a physician and then as a Christian?
Yes, and those may be similar, actually, but I think with gender dysphoria, with people that identify as transgender and want to transition, we want to look at what's all behind that. And in medicine, you want to look at the cause. You want to get the correct. If I don't have a correct diagnosis, I can't give a cure. I can't give a treatment. And sadly, many of these people who want to be a different gender have a history of depression, anxiety, autism, bullying, mental health disorders, sexual abuse, trauma. And so to go forward to a gender transition, no matter what you think about gender transition, without addressing those things. And so you want to address those things. So I would encourage people to very carefully vet a psychologist or psychiatrist, but get help for what else is going on in your life. Because gender transition, as we've talked about, although you can kind of go back, you can't really go back completely. And so I would encourage that for parents. A lot of these young kids, they are influenced by social media. If you have an adolescent who is bringing this to you, well, first of all, continue to love them, continue to be there for them, and I would encourage parents, get your kids off of social media. It is a powerful influence, and get them in for the right help. I would recommend a book called Irreversible Damage by Abigail Schreier. Another thing I would recommend is just being informed and not making any quick changes. Another book with a lot of good information is Lost in Translation by Miriam Grossman, and she gives some very good information at the end for parents as well.
Good. Well, Chris, I very much appreciate you being here on the show to talk about this difficult topic. And I think if there's probably a big take-home message, it would be that while maybe you can't go back if you've done, gender reassignment or any kind of gender-affirming care, the beauty of the gospel is that you can always go back to God.
Yes.
And that you can reverse the damage of sin.
Yes.
And that's really an incredible message of hope that's not only just available to those people that I think we all care about who struggle with gender identity issues, but it's true for every person because we all are broken in our own way, right?
And God loves us so much, and we all struggle with different things, but for people struggling with their gender, they perhaps feel unaccepted in that how they were born or how they are, and that's how God made them, and He loves them, and they are, even if they don't fit into certain stereotypical norms, that's okay. And yeah, as you said, it's redemptive. God is the God of second chances.
Yeah, amen. All right, well, thank you so much for joining us today on Star Cells and God. We really want you to join the discussion in the comments below. Very interested in what you have to say. Remember to like this video and to subscribe for more content. New episodes of Star Cells and God release every Wednesday and are available here on our YouTube channel and your favorite podcast app. Be sure to share this video with a friend, and remember, the more we know about science, the more reasons we have to believe.